You can, you will, you must pass NCLEX. That's right. This is how to pass NCLEX. You're going to love this episode today because we are talking about contact precautions. I am super excited. This episode is sponsored by the NCLEX virtual trainer. You guys know that is the program that I created just for nursing students like you, who want to get a handle on passing this NCLEX. Our NCLEX motivation is excuses or results, excuses or results. You have one or the other. And I'm going to tell you a number that totally blew me away because we're still doing our stimulate your NCLEX, stimulate your priorities of passing your NCLEX sale. And we literally had so many nurses come into the NCLEX virtual trainer. So I know the books are coming. You're waiting for this book. It's coming. I promise you. But we had so many students that are getting ready, gearing up for this 99.2% success rate from the virtual trainer. Here's the number I'm super excited about. Yes, this is how many nurses we have in the virtual trainer right now. Remar nurses, we are just 60 away from 8,000. I know we're going to get that by the end of today. I am so sure of it. And to help you on your way, I got some NCLEX questions for you right now. And again, it's transmission-based precautions study session. So if you have your virtual trainer student workbook, you can find these notes on page 144. On page 144. So open it up, add these to your notes. We're talking contact-based precautions. So, all right, here are my notes. When I say transmission-based precautions, there are categories to transmission-based precautions. And I'm not going to go over all of them today, but you guys know you have your contact, your droplet, your airborne, right? So with contact, we are mainly talking about gloves and gown, right? Droplet, you have your gloves, your gown, your surgical mask. These are things that you're going to be included. It could be a surgical or it could be a non-surgical mask too, just depending on what is happening. And then your airborne or your respiratory, you're going to have gloves, your gown, your respiratory mask, your negative airflow isolation room. So we could spend so much time on these subjects because they are so good, and you guys know that they're a big part of your NCLEX exam, but we're going to narrow it down to the contact-based precautions. And so when I'm talking about contact precautions, what are some things that you want to make sure you're doing? And so, of course, hand washing is huge. NCLEX likes to ask you, when do you wash your hands? You do it when you're entering and exiting the room. Entering and exiting the room. Gloves are also super important because you're not only going to be coming in contact with diseases from your patient, but also their environment. So that means the bed rails, the countertops, right? Their telephones. If they give you anything, you need to have on gloves if your patient has a contact disease, all right? Gowns are used in contact precautions to cover clothing, right? That will have direct contact with your client or their environment. And we always take off gloves before leaving the room, okay? One of my pet peeves is when I see nurses walking around in isolation gowns. And mostly they'll say, I'm wearing this gown because I'm cold. Okay, that may be very true in nurse life, but as a patient, as a visitor, I don't know if you have that gown on because you're cold or because you just got out of somebody's room with C. diff. So all nurses, we are not going to be wearing these isolation gowns outside of the patient's room. All right, transportation. When a client has a contact disease, do we want them in and out of the rooms, walking around the hallways? No, 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 we don't. They need to have limited transport, and if they have to be transported, that infected area needs to be covered, needs to be covered. I'm so glad you guys are here. We are studying today. Congratulations to Nurse Tiara. Nurse Tiara, you just passed with Remar. Thank you for coming on. Shout out to all of my top fans who are watching me today. We are studying, and I'm so happy that you took time out of your busy schedule to come here. So, with contact precautions, not only do you have to know what you can't do and what you can do, but you also want to know what diseases are important. And I pulled this out because a lot of nursing students are familiar with this acronym, Miss We. And this gives you a very generic overview of diseases that require contact precautions. And so, just as a reminder for my new nursing students, if a patient has a contact disease, that means that if you come in contact by touching that patient's infected area or body part or environment, you can also get that disease. So it's very important as nurses for us to know which diseases require isolation. All right, so our diseases are multi-drug resistant organisms. This includes MRSA and VRE. Again, you guys can find my full lecture in the virtual trainer. This is just a high-level overview. The R in Mrs. We stands for respiratory infections. Now, this is the major problem that I have with this acronym, because if a disease is a respiratory infection, which isolation is going to be most appropriate? It's probably going to be a higher level isolation than just contact. But there are some respiratory infections that are categorized as airborne and contact. So you've got to be very careful. An example of one would be varicella. All right, so you have to be careful. If you're just going by this acronym, please use the ones I gave you in the virtual trainer. The S stands for any kind of skin infections. Those usually are going to be contact precautions. W stands for wound infections. If you have a bacteria or you have an infection in a wound, it is more likely going to be a contact disease. All right, so if you have a wound, you have to be very careful in cleaning it if your client has one, okay? Enteric infections, those are the ones that live in your GI tract. Those infections are typically contact precautions. And then also eye infections, you can normally get if you come in contact with that infected eye drainage. All right. Okay. So now that we have done a very high level overview, again, this is for my nurses who are studying in the virtual trainer, because I want you guys to be able to not only learn the information in the virtual trainer, but apply it. So I have some questions for you right now. Do your very best to answer these isolation questions correctly. Question number 1 is this. Here we go, guys. Which of the following would require contact precautions? Select all that apply. Which of the following would require contact precautions? Select all that apply. Here we go. Brooklyn in the house. That's right. Number 1 is impetigo. 2, cutaneous diphtheria. 3, Ebola. 4, epitaxis. 5, herpes simplex. Oh, what sayeth you guys? Here we go. We are talking about which of the following would require contact precautions. I see the answers on the screen. Incredible, guys. And you guys are doing awesome. Yes, I see a few of the right answers. So just a note, I'm going to reveal the right answer. But first, I'm going to give you guys 5 seconds to share this video. 5 seconds to share this video. All right. 5, 4, 3, 2, 1. Did you share it? Did you share it? Here is the right answer. All right. We are talking contact precautions. The right answer is pow. Almost all of them. The correct answer is 1. Impetigo is a skin infection. All right. 2, cutaneous diphtheria. There was a clue in that one. What does the term cutaneous mean? The term cutaneous means skin. All right. So that is contact precautions. And then number 5, herpes simplex. You guys know you can come in contact with that and it will get on your skin or somebody else's skin. It's a sexually transmitted disease. So if you come in contact with those lesions, it can be highly infectious. All right. So that is the correct answer. 1, 2, and 5. Did you get it right? Did you get it right? If not, don't worry. You come here to learn. That's why I do these study sessions, so that I can challenge you and I can motivate you. I got another question coming up. Here it is. Okay. Question number 2. Here we go. I'm loving this study session. Here we go. The charge nurse. Oh, wait, let me go back. All right. Just to go back again, because I want to address 3 and 4. So Ebola is respiratory isolation. All right. If you see that on your NCLEX exam, is respiratory isolation that causes a bleeding hemorrhagic fever. So when you see people, if you ever saw somebody with Ebola, usually like their eyes are bleeding, their mouth is bleeding. This disease process causes hemorrhaging, and you have a very high fever. So that's why it's going to be respiratory.
I'm having trouble hearing you.
Sorry. That's going to be respiratory isolation. And then epitaxis is nose bleeding. All right. So the correct answers were 1, 2, and 5. All right, I'm moving on to the next question. Question number 2, guys, is this. The charge nurse sees a licensed practical nurse caring for clients. The nurse has an active herpes lesion on her mouth. Which is the most appropriate action by the charge nurse? Oh, here we go. Okay. Come on in. We're studying. Is it number 1, reassign the clients to another nurse? 2, ask the nurse to wear a non-surgical mask? 3, evaluate the nurse's assignment and delegate tasks that require contact within 3 feet of a client? And 4, remind the nurse to wear a gown and wash hands before and after client contact. This is a good one. So essentially, you have a nurse and she has herpes lesion. She has herpes on her mouth. Which is the most appropriate action by the charge nurse? Oh, and I see the answers are divided. I see the answers all over the place. Okay, so here we go. I'm just going to show you the right answer. The choices are reassign the clients. Okay, that means give her clients away. 2, ask her to wear a non-surgical mask. 3, evaluate the nurse's assignment and then take away those that require close contact with the person. Or 4, remind the nurse to wear a gown and wash her hands before and after client contact. The correct answer, guys, is going to be number 2. Number 2, we need her to cover that lesion up. Cover it up, all right? This is going to address and this is going to prevent this lesion from the drainage from the lesion. The presence of the lesion will be contained within the what? The mask. So the problem is solved, right? The nurse is still able to provide care. Just because a nurse has a herpes lesion on her face, that does not mean that she cannot provide nursing care. Okay. Let's look at the other options. Number 1 says reassign the clients to another nurse. So then what, you take away all the clients from the nurse. What is she doing? Are you making good use of staff when there's already a nursing shortage? You're going to take away patients. All right. 3, evaluate the nurse's assignment and delegate tasks that require contact within 3 feet of a client. Now, that may sound good, but does that make sense at all? If you're a nurse, are there any tasks that you can do where you don't come in contact with the patient within 3 feet? What will she be able to do? She won't be able to take a temperature. She won't be able to pass medications. I mean, so sometimes with NCLEX, you really have to read it and see if it makes sense. This one, it just doesn't make sense. The nurse you might as well take away all of her patients if she can't come within 3 feet of them. All right. And then number 4, a lot of people pick number 4. But number 4 says remind the nurse to wear a gown and wash hands before and after client contact. Okay, but does this help if the nurse puts on a gown, right, over her clothes and she's washing her hands? What is still exposed? What's still exposed is the lesion on the mouth. And so it was very important for you guys to be able to pick the option that said cover the face with a mask. All right. So that was that one. This is critical thinking. Okay. This is applying content to critical thinking. I got another question for you guys. Are you ready? If you're ready for the next question, go ahead and put hearts on the screen. I'm going to look through the comments. And this is what we do here. We are making sure that you guys are prepared and that you're very forward thinking when you take your exam. All right. Next question is this. A nurse receives a laboratory report that a client has uncontrolled sepsis in the bloodstream. The client also has allergic conjunctivitis. Which action is most appropriate? Okay. Number 1, initiate standard precautions. 2, initiate contact precautions. 3, initiate respiratory precautions. 4, establish care priorities. Okay, which action is most important? I see the answers on the screen. I'm so proud of you guys. I see it. You're doing a fantastic job today. Yep. All right. I'm not even going to belabor this one. Excellent job. Most of everybody has gotten it right. The correct answer is number, I'm waiting for it, number 2. Number 2, absolutely, the nurse should implement contact precautions to protect self and the other clients. Yep. The allergic conjunctivitis is an issue with the what? It's the issue with the eye, right? And so a lot of people know this to be similar to pink eye. And you know, pink eye is contagious. It spreads. If you have one child with it, next thing you know, their brothers and their sisters will have it. So it's very contagious. There was a distractor in this question. Did you find it? Did you see it? The distractor was a nurse receives a laboratory report that a client has uncontrolled sepsis in the bloodstream. All right. And so uncontrolled sepsis is not contagious. It's not infectious. So if a nurse just read that uncontrolled sepsis, then they would say, oh, just do standard precautions. Because normally when you use blood as the main intention of infection, blood is not contagious. All right. We treat all blood the same. We wear gloves. If a patient has a nosebleed, like the previous question, we're not going to say, oh no, isolation for this patient. It's just going to be put on gloves, wear gloves. All right. So you have to be very careful that you don't turn normal body fluid into infection cases, because it's not. Urine, stool, blood, it all requires just gloves, okay? Unless the NCLEX says specifically there is some sort of disease or bacteria happening with those bodily fluids. So you have to be very, very careful. A lot of nursing students make that mistake all the time, all right? So here, the reason why we're implementing contact precautions is because of the allergic conjunctivitis. Make sense? All right. Okay. And if you're having trouble on the screen with Facebook, try YouTube, because this is up on YouTube as well. So I want you guys to be able to see the questions and read them and go along with me. I have one more question for you guys. It's a tough one. It is a tough one, but I know you can do it, and I know you'll love the challenge. Here is the next question. It is this. A nurse is caring for a client who requires contact isolation due to vancomycin resistant enterococcus, or VRE, in an ostomy. Which client is most appropriate to cohort in the same room? Here are your choices. Number 1, a client with scabies. 2, a client with Clostridium difficile. 3, a client with MRSA in a draining wound. Or 4, a client with norovirus. Okay. So we are talking about a client here. They have VRE. Who is most appropriate for them to be in the same room? Also, guys, shout out to those of you who took advantage of the flash sale. It is still going on right now at remartnurse.com. Okay. All right. I see the answers rolling in. Who's most appropriate for this patient? All right. What isolation is required for VRE? What isolation is required for VRE? All right. We got to match up. This patient. I'll give you guys a little bit more room. Listen, if you need to change your answer, now is the time. Thank you so much for sharing this video. Also as well, the correct answer. I see some people flip-flopping. I see some people flip-flopping. And this is not a select all that apply. So this is a great opportunity for you to just go with the answer and stick with it. Okay. This is how you pass NCLEX. The correct answer is, this is going to shock you. This might shock some people. All right. The correct answer is 3, the client with MRSA. The client with MRSA in a draining wound is the most appropriate for this client with VRE and another opening in an ostomy. Because guess what? Both of those locations can be what? They can be covered. They can be covered. When you guys have the challenge of putting patients in the same room who are infectious for your NCLEX, you want to try to put the most similar patients together. Okay, so let's look at the other options. The client with scabies. Thank goodness nobody picked that one. Not one person picked that one, and it just made sense, right? Because you cannot control scabies. I mean, if a person covers their hair, their body, and the thing about it that I want you guys to keep in mind is that when 2 patients are in a room together, what do they have to share no matter what? Go ahead and put it on screen. I'm waiting for you guys. If you're in a room, and don't worry, brother Robert, listen, being a nurse is not easy. So if you didn't get them right today, I'm glad you showed up. I'm so happy you're here. Okay, so just tell me, think about it. If you have 2 patients in the same room, what do they share no matter what? No matter what. Is anybody putting it down? Air, that's a good one. They do share the air, but specifically for contact precautions. Remember, contact precautions, you get it by touching skin or surfaces or bed rails. Another place is the toilet or the sink. Yes. So you have two patients, they got to share the bathroom. And so you have to be like, oh, that's what I think about. That's my very first mind. Can these two people share a bathroom together? So the first client had what? The first client had scabies. Is there any way I can keep the scabies out of the bathroom? Not really. No, like once the patient goes in that room, in that bathroom, there could be scabies all over the toilet, all over the sink. I mean, it's going to be very hard to share a room when the client has scabies. The second client had C. diff. Okay. And you guys know what C. diff is. You have uncontrollable diarrhea. It doesn't end. I tell this story a lot. It's very infectious. C. diff, when you use the bathroom, there's spores that stay in the air. And so those spores are very infectious as well. So it's like, goodness. All right. So there was a nursing student who took care of a patient with C. diff, and somehow she became infected with C. diff. I don't know if it was a matter of didn't washing the hands, didn't have proper PPE on in the room. So anyhow, she got C. diff and she lost 15 pounds in a matter of like a week because she had uncontrollable diarrhea. And so if you have a client with C. diff, nobody else can be shared. That room cannot be shared with anybody because of the bathroom situation. Are you guys following me? Yeah, yes, very infectious. All right. And then the fourth patient has norovirus. And norovirus is what? It's GI. It's like you get it from food poisoning. You get it. It's like if you don't eat, if your food is not prepared properly, if someone's hands are not clean, you get norovirus from a surface or something else, you will be in the bathroom. And so it would be very difficult for you to share that bathroom with another person. So if NCLEX gives you the option of having a patient who has a disease or infection that can be covered, this is your person. All right. Because if you have MRSA in a wound, if your wound gets infected, cover that wound up, go in the bathroom. All right. And so that is why these two were the most appropriate. Does that make sense? All right. Yes. Okay. All right. So these were our study questions. Now here is my NCLEX motivation presented by Regina Callion. All right, here it is. The idea is just excuses or results. Too many of us have excuses, right? Too many of us have excuses for not getting our goals accomplished. And this is the year that it stops. Your excuse, I'm too tired. I'm not smart enough. I failed in the past, right? I have test anxiety. All right. And I'm not saying that these things are not true. They can be very true, but they also are excuses. Okay. So you can have these, right? You can have these excuses. How many of you are dealing with these things? How many of you say these things? How many of you have said these things to yourself this week? And today is only Monday. So how many of you have said these things to yourself today? Right? I'm too tired. I'm not smart enough. I failed in the past, right? I have test anxiety. All right. So these are excuses you can have. Or let me present to you the other side. You can have results. You can have results. So if you're tired, guess what you can do? You can adjust your sleep. All right. Or you can just push through being tired. I know it's easier said than done, but it is possible, guys. It's possible. If you don't feel like you're smart enough, guess what? We are all learning as we grow. And so what you need to do is just get with the right help, reach out for help, admit that you need it. All right. Admit that you need it and start the learning process. A lot of you guys showed up here. You're tired. You don't feel like it, but you showed up to the motivation. You showed up to the studying. All right. A lot of you guys, your excuse is that you failed in the past. Hey, you thought you would have been a nurse by now. You thought you would have already been working in the NICU, or you thought you would have been, getting your 4th or 5th paycheck as a nurse, but that's not it, right? And so I have to tell you guys today, don't give up. Don't give up. All right. And anxiety. I'm going to do a whole very big thing on anxiety, but what you got to do right now, don't focus on the anxiety, focus on the content. Focus on the content. All right. Because you guys are in a position to get results. Okay. And I want you to have the results instead of the excuses. All right. And so that's why I do this. I'm here for you guys to make sure that if you have a choice between excuses and results, guess what you're going to pick? You're going to pick the results. You're going to pick the results. And so if you need help, if you guys need help, get the virtual trainer, okay? Follow the daily study calendar and register for your ATT. This is super important in order for you to pass your NCLEX and get your license, all right? So in the end, I want you guys to remember you can have excuses or you can have your license. I mean, that's what it gets down to. But you cannot have both. All right. You cannot have both of these things. You're going to have one or the other. All right. So also with God, it is possible. Okay. With God is possible. All right. And somebody really needed to hear that. Somebody today really needs to hear that. So I'm going to do a challenge. If I can get 100 shares on Facebook and I can get 100 shares or thumbs up on YouTube, I'm going to come back and do a power study session with you guys right from the virtual trainer. But I got to get those shares. That's what I'm working for right now. Also, I'm going to take some questions because I know you guys have a ton of questions. The first question is, yes, if you go to remarnurse.com, the VT package is still $180 off. So that sale, the Stimulate Your NCLEX sale, is still going on. It's still happening. So head over to remarnurse.com and we're going to keep that sale going until the supplies run out. That's it. All right. All right. Next question. Somebody asked, what is an ATT? An ATT is your authorization to test. And it is what is granted to you when all of your paperwork is correct and you have paid in order to test. You get what Pearson VUE calls the ATT. It's the authorization to test. Okay. What else? I would like for you to do a video on the transition from LPN to RN. All right. What do you mean by that, Capri? Do you mean what it's like, what classes are needed? Let me know more about that. All right. Esther says, my license is worth it. I can do all things through Christ. Absolutely. Absolutely, you can. Okay. So I also saw some people that said that they are graduating in a few months, a month or 2 months, and they want to know, should they get the VT now or later? All right. So first of all, I want to say congratulations. That is amazing. If you are graduating, whew, you almost are finished. I would say when you think about the virtual trainer, one of the benefits of the virtual trainer is that when you purchase it, you get 3 months access to all of my lectures and not only my NCLEX review, but my fundamentals, all of my everything that I do, all of my classes and everything. So I would consider that, especially if you're taking your exit exams, because the virtual trainer is really great for preparing you for your HESI exit exams or your ATI final exams, as well as NCLEX. So think about it. If you feel like you really need help putting the picture together, maybe you feel like you have just pieces of information, but the virtual trainer is really good at taking you from point A to point B so that you have a better picture of nursing content. Okay, that's what I would say. Any tips for nursing school? When is the NCLEX exams changing? Great question. Nursing school. So my tips for nursing school would be a little bit different than my tips for NCLEX. I would say for nursing school, your major priority would be following the syllabus of your instructor. What I find is that nursing instructors do not always, how can I say this? What I'll say is that nursing school can teach you one thing, and then NCLEX can expect you to know something different, right? That's just how it is. Nursing school may say you need to know A and B in order to graduate. NCLEX will say you need to know A, B, C, and D. Okay, so for nursing school to be successful, you need to be able to understand what that teacher is trying to teach you. What is important based off of their lecture, off of their reading assignments, okay? If you have to spend extra time with that instructor, go to their office hours. And this is anybody that's getting like a C or a D in a nursing class. If you're getting a C in a nursing class, you're missing the major points of what that instructor is trying to teach, all right? That's one of my tips. Also, don't be afraid to ask for help early. If you know you need help, if you know you're not understanding how a subject, reach out early, because nursing information builds on each other. So what you learn in fundamentals should be presented again your senior year, and you should know something about it. All right. That's my advice for nursing school. And if you can't do any of that, get in the virtual trainer. I'll make it simple for you. Okay. Also, quick facts for NCLEX. If you're a nursing student, you need to have this book, because there are so many topics that this book will break down for you in nursing school. You'll get the major points of them. All right. That's another thing. All right. Let's see. Exam. Okay. Got my exam, got my VT, feeling like I am not retaining. That's pretty common. I would say if you feel like you're learning a lot and it's not sticking with you, all that means is that you need more review. All right. And maybe you're trying to study too much at one time. Okay. Or maybe you need to switch up how you're learning. Let's talk about more review. If you're in this book, okay, it may take you more than one time to go through this entire book. I don't know, maybe people can put up on their screen, how many times did you review this book? I find that if I do this book front to back and then I go through it again, I hear something different, or something will make sense the second time I hear it, right? Or if I'm writing it down, then I'm retaining it a little bit longer than if I'm just listening. This quick facts for NCLEX, you can study this book 3 and 4 times, all right? And you will be learning, feeling more comfortable. So it may take you more than one time to go through this material, okay? Also, the second thing I said is if you're studying too much, remember that everybody learns at a different rate. So if I say study 2 pages of this and 2 pages is too much, then study half a page. Or if you feel like you're not sure if you're retaining it, have a friend ask you questions out of this book to see for sure. Because sometimes we may not feel like we're learning, but we actually are learning. We actually are learning, okay? Somebody said, I misplaced my calendar. If you misplaced your calendar, it's easy to find another one. Just go to the file vault in your virtual trainer. In your file vault, go to NCLEX resources. And if you go to NCLEX resources, boom, your calendar is right there, okay? All right, how much is the quick facts? Check out remarnurse.com if you want quick facts, because it'll tell you the taxes and everything and all that stuff. So go to remarnurse.com for this book, okay? Tiara says, and Tiara passed, she says, I studied the VT twice and quick facts 4 times. Yes, listen, I was in this VT today looking at psych stuff and I'm in it all the time. This quick facts book, this is a lifelong book. You can have this book forever. All right. Okay. Benay, honestly, I don't know if you have the virtual trainer or not, but if you feel like you are all over the place, please look into my program. I promise you will not feel like you are all over the place. You will know exactly what you're supposed to be studying every single day. And when you don't study, resting. I mean, a lot of nursing students, remember this licensure exam covers so many topics. And even the suggestions that they give you, if you look on the test plan, there are so many suggested topics, possible topics, that it is easy to get overwhelmed. It is so easy to get overwhelmed and feel like I have no idea what's going on. I don't know what I'm going to be asked. But I promise you, there is a very easy and structured way to study for the NCLEX exam. And you don't have to be confused, and you don't have to have anxiety about it. You can do this, all right? You can do this. I want to show you how, all right? I want to show you how to make it easy on yourself. Please, if you don't do anything else, just go to remarnurse.com and watch the testimonials. The testimonials are the motivation for today. All right. I am still learning. I am still learning. Will I know it all? That's a great question. You won't know it all. Okay. And that's okay, because you know what the NCLEX tests on? The NCLEX, you might not know this, but let me tell you this. The NCLEX is only looking for the minimum competency. The minimum. That's what they actually say on the website. They're looking for the minimum competency. And I don't care who is watching this. I believe that you can learn the minimum. Okay. Listen, they're telling you, you can get away with just knowing the minimum. And that's perfect, because this is an exam for new nurses without any experience. And that's you, right? If you're watching this. Okay. Let's see. Safety. Will I know it all? I'm a pre-nursing. Can I study the quick facts? You sure can. Welcome if you're pre-nursing. You can study the quick facts. And if you haven't taken your T's, if you have not taken your T's, I also have a quick facts for T's as well. So yeah, welcome. We welcome all levels of nursing here. I bet when you get in nursing school, if you get the quick facts, you're going to be ahead of your class. You definitely will be. All right. So definitely consider it. Okay. Yeah. The minimum competency. So thank you guys so much. What if I just want the VT and practice exams? Okay. Well, the VT, let me tell you this. When I say virtual trainer, to me, the virtual trainer, not even to me, in reality, the virtual trainer are my lectures and these two books. That's what makes up the VT. Okay. So some people say, well, just give me the book. All right. Just give me the book. I just want the book. But when you get the book is blank. Okay. The book is empty because the lectures are in the virtual trainer that you watch. They go together. You watch the lectures and you take notes, just like you do in nursing school, just like you do in a nursing class. And so this is the perfect way for most students to study, by hearing and writing. It's a combination. And then so students that just get the lectures, it's tough to just have the lectures, because that means you're not doing the writing and you're not doing the homework. And so for my program, it's mandatory to do both. All right. Because I want my success rate to be based on real stories and real people. And so that's what we have here. All right. Trust the system. Trust the system. Don't try to usurp the system. All right. So absolutely. Remar has helped nurses pass NCLEX their first try. All right. And for the last 11 years. That's true. Okay. All right, guys. Thank you guys so much for joining me today. Oh, my goodness. We are so happy that you are studying with me. In 6 weeks or less, you can have your nursing license. And guess what? You can get a permanent stimulus. You can get a permanent stimulus. So nursing instructors, registered nurses, licensed practical nurses, you wouldn't even have to worry. The $1,400 would not even be a thing, okay? Because you have your own stimulus package every 2 weeks by your nursing license. And this is what we were all saying last week. Some people will use that stimulus money and they will invest it into something greater. I'm trying to encourage you guys, use all of your efforts to get your nursing license, because it truly puts you in a whole different category. You become a working professional. You get that RN behind your name. Oh my goodness. You get that PN behind your name. It's an immediate pay raise. And I'm just not talking about 10, 20 cents. All right. Because when you don't have your license, you'd be lucky to get 10 cents after 2 years working somewhere. I'm talking about $20. I'm talking about shift differential. I'm talking about healthcare coverage, paid vacation. That's what I'm talking about, guys. And so I want you guys to make that connection. That is real. It's a real thing. It's not, your license is like hitting the lottery every single day. All right. I can go on and on and on and on and on. But I'm telling you guys, whatever you can, elevate your priority. Excuses or results. Excuses or results. I'm going to get on here every week. You guys know I do this every week for y'all. Every week. Excuses or results. Which one do we have today? We're going to have the results. Okay. All right. So this is what I can tell you guys. It's the same thing I say. You can, you will, you must. All right. Oh my goodness. Mirtha says, I brought a new MacBook, iMac, to study my virtual trainer. That's what I'm talking about. Listen, make it right. Set it up nicely. I love that. I love that. Investing in yourself is always a winning. It's always a winning return when you do that. Okay, guys. So thank you so much. I love spending time with you. I will see you inside of the virtual trainer. Get out your study calendar. Get out your study calendar and accomplish your goals for today. All right. You can, you will, and you must pass NCLEX.